بسم الله الرحمن الرحيم الحمد لله رب العالمين وصلى الله وبارك وسلم على نبينا محمد وعلى آله وصحبه أجمعين وبعد. Many have actually asked me about this vaccine. Should we take it or not? So we have, alhamdulillah, managed to make this arrangement so that whoever is interested to know. Actually, there are two aspects to it. The Islamic ruling, some people are asking the Islamic ruling or Islamic perspective. But I think the majority is concerned about the vaccine and should you take it or is it beneficial? Is there any harm in taking that? And there are a lot of people talking about that. Many webinars and seminars and talks and fatawas are flying around talking about this issue that majority obviously in favor and promoting this taking of the vaccine. I don't want to go too much into that, but as you know that the vaccination is already in progress, and in fact now there are 3 vaccines available, and I would expect more to come. There is another 4th one I'm aware of, which is under trial, which is in the form of a nasal spray. So you will just take a nasal spray, and that is your vaccination. So make it more easy. Firstly, it's important to understand that people are divided in their acceptance. There are some who are very keen to have it. Those second group who are less keen, and those who are not at all keen. They don't want to. Because they are more influenced by the media, where there are those conspiracy theories and videos that they see, and because of that there is a scare factor. But it's important to realize that those who are not keen or those who are refusing, they are not conspiracy theorists. This has become almost a weapon for the opposite group to bombard those who refuse to take or they are worried about it. Anyone who will speak again, they will say the conspiracy theorist. In fact, it simply shows the lack of knowledge and understanding of a person who dismisses everyone who would say that vaccine has a problem and he's not fully convinced that he should take, or would present some kind of argument. So straight away just dismiss them by calling them conspiracy theorists. So it's important to be easy with people and understand the other side's view as well. Secondly, Islamic perspective. Okay, and as I said, that many people have made some kind of gathering or talks or webinars, especially a number of those I have actually watched myself, where they say that we are going to give the Islamic perspective. Very little is actually spoken about the Islamic perspective. So they'll start with an ayah of Quran or a hadith, and then after that whole discussion is about the medical aspect, which is of course is required and it's important, but then they get lost into that without applying what is there for a Muslim to understand. The basic ruling in Islam concerning treatment is that it is recommended. Okay, this is the first thing that I want to mention before we go further. So what do we say? We say the asl of treatment is recommend, just what the scholars call mustahab, or in the plain language, common understanding, they will say sunnah. It's a sunnah. Okay, it's not wajib. Though, and the reason they said that this is a sunnah is the word of Rasulullah when he said, "Fatadawaw," then treat the illness. He said, "Inna Allah anzala da'an wa dawa, wa ja'ala li kulli da'in dawa." Indeed, Allah has sent down the illnesses and the treatment, and He has made for every illness a treatment. And then He said, "Fatadawaw," so that treat the illness. "Wala tadawaw bi haram," but do not treat with something which is haram. Okay, so this is the basic principle. And the scholar, they said that on this basis that they said that treatment is something recommended, mustahab. But it can be wajib, not all the time. It can be wajib. It can be wajib in situation where the illness is fatal and the treatment is guaranteed to prevent the illness. In such cases, treatment is wajib. But the baseline ruling is that it's recommended. It can be permissible also. Like a person has headache, he wants to take paracetamol, he can take it. This is not an act of reward, etc., as some people think. No. He wants to take it, he can take it. He wants to leave, he can leave it. In some situation, the treatment is disliked, makruh, such as treating with the fire. So it's not permissible, meaning no, it's permissible, but only in case of necessity. Generally, as Rasulullah said that I forbid my ummah to use the treatment with the fire. But he did not make it haram. Rather, he himself allowed some of the companions to use that treatment. I'm not going to go with all the details and hadith because that will take a long time. So I will just give you the brief gist of these things. Okay, so treatment can be makruh as well, like the use of fire for treatment, like the laser treatment we use. Or treatment can be haram, like the use of wine for treating. Okay, if you use the wine for treating, this is haram. Okay, so this is a brief outline of the spectrum of treatment that it can be obligatory, it can be recommended, it can be permissible, it can be disliked, makruh, and it can be haram. But as I said, the baseline of the treatment is that it's mustahab, it's recommended. Okay. So should a person use a specific treatment or not? This depends on two conditions. This is the Islamic criteria. If those two conditions are fulfilled, then you can take the treatment. If they are not fulfilled, then that treatment is not permissible, or it is not something that you should do. First condition is there a need for the treatment? What we call haja. Is there a haja? And is there a need for the treatment? So for example, you don't take the tablet just because you feel like. When you are ill, then you take the tablet. A person that does not take on Monday morning, he wakes up and he thinks that I should today take some amoxicillin or maybe paracetamol. Just he feels like. We don't do that. If there is a headache, if there is an infection, then we take the treatment. So the need. Second, and I will come back to this issue of need in relation to vaccine in a minute. Second condition is there knowledge about the treatment? Does a person know about the treatment? You are not to take the treatment blindly. As Rasulullah sallallahu alaihi wasallam said, "Ma anzalallahu da'an illa anzala lahu dawa. Alimahu man alima, jahilahu man jahila." Allah did not send an illness except that He sent down its treatment, but this is known to the one who knows it and not known to the one who does not know it. And one of the implications of the hadith is that you have to know the treatment. You cannot take something blindly, whether it's halal or haram, whether this. So knowing means there are three things that you have to know. Is what you are taking permissible? And is it halal or not? Number two, that is there a harm in the treatment? what in modern terminology we say safety of the treatment, safety of the drug. So this is important in Islamic criteria. It is required because Allah subhanahu wa ta'ala has not permitted harm. Rasulullah said, La darar wa la dirar. There is no harming and no being harmed. So when you take something or you eat something, you do something, you need to know, is this something that's going to harm me? Third thing that you need to know, is the treatment beneficial? Okay, something you're taking which is not harmful. So if somebody gives you a tablet of glucose and say, this is for your headache and this has no side effect. So, okay, glucose, no side effects. It's something, harmless. But is it going to benefit you? Is it going to remove your headache? And if the answer is no, then it's not something that you will use it. So these are the three things one needs to know. Is it permissible? Is that a harm by taking it? Is there a benefit in it? The harm, we say safety. Is the safety of the drug or the vaccine established? And the benefit, we say efficacy. Is it effective? And that's what they compare, the safety and efficacy in the drug. Okay. So this is the basic frame. Okay. This is the Islamic criteria briefly for taking the treatment. However, applying this criteria to achieve the right result requires correct ingredient into correct information. So if I, for example, say, okay, this is a frame. Okay. So we have a framework here. This is Islamic criteria. If you put the right ingredient here, the result will be right. If you put the wrong information here, the result would be wrong. So these four things which I have told you, or these two things in the condition, that is there a need. So if we show that yes, there is a big need, then we'll say, yeah, then it should be taken. On the other hand, if I say no, there isn't a big need, then the same criteria will answer you by saying that you shouldn't take it. Is there knowledge of those things which I've mentioned? Is it permissible? It has any harm? It has any benefit? So if I prove to you, yes, there is, it is perfectly halal, there is great benefit in it, and there is no harm in it, then the outcome of applying this criteria will be that you should take it. On the other hand, if I say no, there is a lot of harm in it, and the effectivity is not proven, then you will say, okay, that means that it does not fit the criteria. Okay, so this is the important thing. Okay, so the first condition, is there a need for the vaccine? Okay, to answer this, you need to know about the virus. Is there a need for the vaccine? Because what we have been told is that this is a killer virus, and this has led to a pandemic, and the only way we can prevent this is by taking the vaccine. Okay, so the first thing, now this is important to understand. Number one is that the coronavirus, does anybody know that when was the first time the coronavirus was found? They found out about the coronavirus? Any idea? I'll show you. I want to show you something. Okay, summer 2019, huh? December. Okay. Can you see this document on the screen? Can everyone see the document?
Yes, we can see.
Good. Okay. Now see that this on the top of the document, what does it say? Journal of Clinical Microbiology. Yes. This document is from American Society of Microbiology. This is not some conspiracy theorist, some nonsense third party. This is a very high status, renowned organization. Okay, American Society of Microbiology. And the topic of this this document is the viruses and bacteria in the etiology of common cold, which means that the viruses and bacteria which cause the common cold, etiology and a causation of the common cold. Yes? Okay. I don't want to take you through all the document. There's no point. That's not the purpose here. But what I want to do is to show you this. So what they did, they showed what are the viruses every flu season which come. Okay. So you can see here that first they showed the first one, they showed overall level of viruses. The second one shows the rhinovirus. Okay, rhinovirus. So you can see that when these are according to the time of the year. So if you go right underneath, you will see November, December, January, February, March, April, and until November to November. Okay, so these each bar represents a month. So you can see that the rhinovirus appears in November. It's on a low level in December, January, February. March it goes up, and April it achieves the peak and then goes down and then reappears again. There is a break of in between where the weather is better and this usually disappear, and they, because the people who were studying, they were on break. Okay, next one is what? Coronavirus. When was this document published? Did anybody notice? At the top of the document. Huh? In the 90s. It's not December of 2020, 20 years ago. And actually it's not, this is much older than that. This has something that has always existed. Okay. The third one is the called the RSV, which is respiratory syncytial virus. Then the fourth one is influenza virus, which causes the full-blown flu. But all of these are implicated in the flu. See, the common cold, etiology of common cold is being discussed here. When the flu season comes and you have, then all these viruses, they are merged together and they all have some effect in the flu that is caused. So this is why the experts, they said the rhinovirus is what causes rhinorrhea. And when your nose start dripping, this is called by rhinovirus. Then you have a little bit of sore throat. This is called by adenovirus or bit of coronavirus. Then you have the chest symptoms. This is influenza virus. So it's a mixture of that. Okay, but the purpose that I showed you this document is that this coronavirus is known to man for a long time. This is not a new virus. Okay, it is a part of the seasonal flu every year. Okay, so remember this. This is the number one thing to understand. Number two is that the viruses, they undergo a phenomenon called mutation, which means, you have a virus like this. If we say the virus looks like this and it has some protein tentacles, usually viruses have that. They have a capsule or capsid or an outer layer, and then they have these tentacles made of proteins. Okay. So mutation means one of the things, maybe this will make a slight change. So another tentacle appeared over there. And I'm giving the example. It's not like this, it's different, but just for understanding. This is what is called mutation, that it has changed. Some molecules have changed. Okay. So this means that it was, for example, coronavirus number 1. By this addition, it became coronavirus number 2. Okay. It's not like that. The coronavirus has 4 categories: alpha, beta, gamma, and delta. Okay, these are the 4 classes of coronavirus known to man for decades. So when the change occurs like this is what is called a variant. And the variation is extremely common in viruses. They are all the time, they are mutating. Okay. And the result of this mutation and variation is this virus called COVID-19 or SARS-CoV-2. That's the name is given. This variant appeared. Okay. All the nonsense stories that came from the animal, came from the bats or penguin, or how it's transferred, all this gossip, we don't know the asal of that. No scientist has actually conclusively said its root and its how it transformed and traveled and from whom to whom it went, etc. So we are not aware of. What we are aware of, this is coronavirus is extremely common virus. It lives in the man and it also lives on the animal, common to both, with some differences, variation. Okay. Number 3 is that this brings to the question that this SARS-CoV-2 or COVID-19 virus, is this a killer virus? As this has been made famous that this is a killer virus and that it has led to a pandemic. So these 2 questions I want to address, inshallah. Is this a killer virus? And is this what we are seeing, a pandemic? Okay. To answer that is this a killer virus, it's important to know a little bit about the immunity from the viruses. These are technical things, but you cannot actually reach a conclusion unless you know a little bit of that. So how the immunity works? When the virus enters the body, there are 2 kinds of immunities generated in the body. The one that is caused by antibodies. This is caused by beta cells in the body, beta lymphocytes, and they produce the antibodies. Okay, antibodies are short-lived. They come on, they are produced in response to the virus entering into the body. They fight and kill and destroy the virus. Then they do not last in the body for a long time. That memory remains. If the virus comes again, then it will be produced, but maybe in 3 or 4 or 5 months, the antibody will finish. There is a second mechanism. I said that viruses, they create 2 kinds of immunity in the human body. First one is by the production of antibodies. Second type of immunity is what is caused by what is called T cells. Okay, T cells are lymphocytes, so in a type of blood cells, which memorize the virus, and these have long-term memory, decades. If the virus comes after 20 years, the T cell will be able to fight. They remember and they would fight. Okay. The advantage of this is that this T cell will remember a type of virus. Okay. Like the virus looks like that, it will remember. If a second virus comes with a slight variation, so it has, like this, for example. So T cell will see that 80% similarity and it will fight against that. And this is why people who had the original SARS and they were exposed to this COVID and they did not fall ill. And a study was conducted and that was the result. Is known. So the T cell have what we call a cross immunity. They give the person a cross immunity, which means that if you are immune to influenza virus, then it will show some degree of immunity to the coronavirus or to the rhinovirus. Plus, even more easy if another variation of coronavirus comes. Then that's less difficult for it. So so this is the two mechanism of the immunity. Okay, and this is the reason. This actually leads to two results. Number one is that because antibody is produced and the virus affects everybody. When the virus comes, it affects everyone. So the flu season, nobody escapes. In fact, if you think, then you will find that hardly anyone has escaped this coronavirus. But majority of people will have mild symptoms. So all of us had a little bit of sore throat, fever, maybe a little bit of cough, some symptoms, maybe a little bit loss of smell, or commonly people. So majority, maybe 80–90% people have showed some symptoms. Some people will not show symptoms, but they will still be exposed to the virus, and they have generated the immunity. Once you generate the immunity, then there is no second wave. This is why they said the viral infection does not have a second wave. Okay. Individual can be reinfected, but in the masses, the second wave cannot come because there is widespread immunity already has developed. And actually the immunity is already there because of the previous year's flu that we have had, because of this cross immunity that results from the T cell. So I hope I'm making some sense. Okay. But the gist of it is that once the immunity is built in the masses, it's not possible to have a second wave. But there is a way to generate. Of course, you can make an artificial second wave, and there is a way to do that, which has, of course, been we have seen, and many expert scientists have written and spoken about that, how this is done. So what you do is that in the initial phase of the virus, when the virus season begins, you remember that in March, April, there were hardly any tests. They said test is coming, we have problem, and the people were complaining, why aren't you testing the medical staff? Why aren't you testing the nursing homes and the residential homes? And they were saying then, the logistic difficulty. This is the time to test the masses, widespread testing. Why? Because, for example, if you test 1,000 people, you test 1,000 people, then you see how many people fall ill. So you find, okay, 50 people fall ill. Then okay, how many have died? Okay, 1 person has died. If you test only 100 people, 50 people fall ill, 1 person dies. Can you see that? We will say 50% people were affected. And mortality, death rate is 1%. If you look here, because you did the widespread testing, the death rate is not 0.1%, not 1%. Okay, this is one factor. It's a very complex issue. Second factor is that those days, anyone who will die is a COVID. So the experts, they said that what we did is that the death caused by COVID plus death occurring in presence of COVID. Why? Because, as I said, all the masses have once the viral season come, everyone has virus. Everyone is exposed to it. They have some antibody, and they have some leftover virus particle in their throat and in their nose. You take the swab, you look at it, and you will find some RNA particles. And you say, okay, this person is COVID positive. Another person has the cancer. He died because of that. But because he was, when he came to hospital, you tested and it was positive, so you said the COVID death. Person had a heart attack, came to the hospital. You tested and it was COVID positive, so a COVID death. Really, I can go on talking about this the whole night. The things that was done upside down. So the situation of the graveyard, the burial, how people were frightened and scared. And then another factor in this, the people dying at home because they didn't want to go to the hospital. Fear was so strongly instilled in their hearts. Another factor is that somebody will develop the symptoms, plus he will be heightened with anxiety, severe anxiety. Just imagine people don't have those who do not have the belief in the akhirah, in the judgment of Allah subhanahu wa ta'ala, in his mercy, in the definiteness of the death and the afterwards. Muslims have suffered for what about the other ones? So they will have anxiety, and the anxiety will affect their breathing. They will come into hospital, they will be intubated, and then matter is over. They are not allowed to see the relative, which is a big consolation. It encourages a person. They are left thrown in isolation. Even the staff doesn't want to go near them. So these things collectively increase the death rate. Okay, okay, the first wave settled, then they started doing the more testing. All the experts know that once the virus has spread, you don't do the testing, you stop testing. Because the more you test, more positive result will come. Before we found out of 1,000, 100 were positive. Now, after 3 months, for example, if you test 1,000, you will find 900 positive. So now the graph is going up. Now, see, the second wave has come. Okay, so more testing, more positive. Now we come to this cold weather, winter weather. Now this is the flu weather, time of flu, and the time of flu, death do occur. People then die of the influenza. So the death are obviously are going to increase in this. You make more cases by testing extensively, and number of deaths are obviously by the flu, this more. So this becomes a second wave, more cases, more deaths. Okay, how many, but why is this all? So somebody can ask, okay, so why is this? So the answer is that so that you push people to the vaccination. Simple as that. Pharmaceutical companies are known for this kind of thing. And the WHO is corrupted because of that. They follow the agenda pushed by the pharmaceutical company. For somebody to say the pharmaceutical company, we have to trust, this is a very foolish statement. Allah subhanahu wa ta'ala says, Ya ayyuha alladhina amanu, in ja'akum fasiqum binaba'in fatabayyanu. When fasiq brings you a news, investigate it. We have taken this is being promoted, mashallah, scholars and the knowledgeable people sitting there talking about this and saying that we have to trust. And the answer is what? Answer, they would say, if you don't trust us, then they will put themselves in between us, medical profession. If you don't trust us, you cannot take paracetamol. You cannot do this, you cannot do that. Do you know that when you are under anesthesia, then is full control of subhanallah, Allah subhanahu wa ta'ala, where is he? Doctor is given the life and death. He'll sneeze in the anesthesia and you are gone. When we take the treatment, if it becomes necessary, we take the treatment, we go under anesthesia in trusting Allah subhanahu wa ta'ala. Doctor doesn't have any power at all. If Allah has decreed our death in the hand of somebody, no one can remove that. And if Allah has subhanahu wa ta'ala has not prescribed the death, no one can touch you. So this is important to understand. This kind of emotional blackmail and wrong statement, it's not appropriate for a Muslim to talk like this. Talk in a just way. So this is the issue to push the agenda of vaccination, because the vaccination is billions and trillions dollar worth business. You need to necessitate that. In fact, you know, the soon it will come, as I showed you earlier, that the antibodies do not last for long. So the vaccine, when the vaccine will be given, they will say the antibody is only for 4 months, 5 months, 10 months. So this means you have to repeat the vaccination every year. So it becomes a yearly thing. So, mashallah, business is secure. That's the issue. It may not be harmful, but it, you know, it gives the revenue. Okay. So this was the case actually. But I want to show you the mortality risk first, so that you understand. Ibrahim, we need the document for the mortality rate, the UK MFA document. Yes, it's called UK Freedom, Medical Freedom Alliance. This is a very important website, actually. I will recommend for all of you to have a look at that. You know, send the link to them and also show the document. Right, I want all of you to pay attention to the first paragraph, where it says the risk of dying from COVID-19 is directly comparable to seasonal influenza in most age groups, which means that it has the same death rate as the influenza. And it's significantly lower than flu in the children, lower than influenza in the children. This is calculated with what they call IFR, infection fatality rate. Okay. The infection fatality rate for COVID-19 is 0.05% for ages less than 70. Anyone who's less than 70 years, his chances of dying is 0.05%. And this is around the same level as the seasonal influenza. This, which is calculated for UK, is 0.1 to 0.3. In fact, majority of the world is like that, 0.1 to 0.3. Yeah, you can see that. And for the coronavirus, it's half of that, half of the lower limit. If we say 0.1 to 0.3, do you know that UK's population is 66 million, according to the Office of National Statistics. 66 million, 0.1 means 66,000. So we will say when the flu season comes, 66,000 people are likely to die if it's a light flu. If it's a severe season, then 198,000 people. 198,000 people dying in flu season is acceptable as a normal. Have you ever seen the briefing of the government on every day in the flu season? There was a very severe episode of flu season. I think it was 2018. Nobody gave any press conference on that. Nobody made that into an issue of epidemic. Okay, people below 45 years, they said the even less than that. People who are above 80 years of age, they have higher rate, but is still similar to what they will have as a result of flu. And the majority of the people who die because of the flu are the old people. This is known. When they say hospital, why the hospitals are filled? Because many of the hospital staff is dismissed or given leave because they have to isolate. Test the staff because they are, as I said, everybody is exposed. Everybody has some virus in his throat. Everybody has some antibodies. Test them. Say, okay, COVID positive, go home. Now less staff to handle the patients. Patient will be crowded. So that is the issue. The many people have actually shown that and I have seen myself, and we know hospitals were empty. In the previous wave, hospitals were empty because nobody was going to hospital. Okay, now let's turn this document off. I'll come back to this for some other reason later, inshallah. So now we know that you can create a a wave like this. There are other issues, the issue of lockdown. That lockdown was actually done after the peak was passed in the previous wave. But I'm not going to go into that issue. I want to just focus on the issue of vaccine. So now you know about the mortality rate, and you know that this is not a killer virus. In fact, if anything, it is milder than seasonal influenza virus. Influenza virus is known to be the strongest among those 4 or 5 I showed you on the viruses which cause the cold or the flu. Okay. Second question, is this a pandemic? The fact is that viruses are always around. Okay. If you look for them, you'll find them. So you can find the viruses and make a pandemic if you want. This is what happened in 2009. Have you heard of the name swine flu? Everybody has heard that, which occurred in 2009. By the way, I've actually forgot that these figures of mortality, which they have, which I've showed you in the document, the basis of this is a huge research work which is done by a person called Dr. or Professor John Ioannidis, very famous epidemiologist of Stanford in America, a person of international repute. His paper has been published at the WHO bulletin. Brian, can we see that? And if they have published on WHO bulletin, then this means this is authentic, and nobody can question it. Everyone has to accept this. See, what does it say? Publication bulletin of the World Health Organization, and the person who has done is John P. Ioannidis. He has shown that the mortality of this virus equates to the, or if anything is milder than the, if you see the result, he has included 61 studies, 74 estimates. This is a retrospective data study. And conclusion, he said the infection fatality rate of COVID-19 can vary substantially across the different locations, and this may reflect differences in the population, age structure, and case mix of infected and diseased patients, and other factors in other illnesses, etc. The inferred infection fatality rates tended to be much lower than estimates made earlier in the pandemic. Estimates made on what? On mathematical calculation, which was done here in London in Imperial College by Neil Ferguson. That model showed the million will die. So this retrospective analysis have from all over the world, this is done. Okay, anyway, I don't want to overemphasize this. This is enough. You have seen the document. You can have the link for this, and you can have a look. If anybody technically oriented can go over the document more properly. Okay, but I want to move further. Okay, so if you go back 11 years ago, 2009, there was a company called Viratech. They were given this job in Mexico to go around the hospitals and check for this virus, H1N1 virus. This is the swine flu virus. So we don't know who paid them. So they went around and they took the samples and they said, okay, they found 500 cases. So they said, oh, this is something new and dangerous. Then this figure was given to the Imperial College. Guess what? Who did that? Same person. He came up with the idea this is a swine flu pandemic. So swine flu pandemic became, wide. Everywhere they started testing, and everywhere they will find this because it's present. As I said, that we are full of viruses. Our bodies, inside our body, our food, everything has viruses, millions of viruses. So they picked one specific one and they, made the issue. And then they said this is pandemic. Then the vaccine was brought and the campaign for vaccination. So what happened to that? I want you to watch a small clip of video now. This is a Channel 4 report from 2010. Did you have a deja vu? Doesn't the story look familiar with what we are going through? So the same thing, no difference. Same people were involved, same outcome was shown, and same thing. So this is the issue with the. So we say this is not a killer virus. This is not a pandemic. Okay. You can very easily label people that these are conspiracy theorists. The answer for my answer to this is that what is wrong with that? Being suspicious is human nature. This is in the nature of, and this is a protective phenomenon that Allah subhanahu wa ta'ala has provided us. This is the reason in Surah Al-Hujurat, Allah subhanahu wa ta'ala says, Inna ba'da dhanni ithm. Yani do not do too much dhan, too much conjecture. Don't become paranoid, because some dhan is sin. Didn't say that all kind of dunun are sin. To be suspicious about, Ya ayyuhalladhina amanu jtanibu kathiran min ad-dhan. Don't do excessive dhan. Wala tajassasu. Don't be suspicious. Because Allah subhanahu wa ta'ala said, Inna ba'da dhanni ithm. Some are sin, which means that some are okay. Why? Because some are necessary. When we see something moving, then we see, okay, there is some danger here. You suspect something because of what you have, signs you have seen in other places. Okay, this is for us. So it is not allowed for us to be suspicious, but it's allowed for those who are doing this. Are they not suspicious that this has gone to such extent they are spying against their own people? Is the result of that. And I'm not going into this matter, but what I'm saying is that to dismiss people by calling them conspiracy theorists, this is wrong. There are some who have invented videos and things that 5G, you will be put radioactive in your body, and the 5G is brought for that reason, so you become an antenna and they will know where you are. This is exaggeration and nonsense. But things which are based on the scientific facts, fools are not talking about those. Scientific expert and medical experts are talking about that. Okay, there is a website called Evidence Not Fear. Okay, you should see that. Those people, I will recommend this one for those people who are technically advanced, meaning that if they have scientific knowledge, especially doctors or pharmacists, those who understand the chemistry and the biology, organism, and preparation of the drugs. For them, these are very useful. Others can also, some parts are good for the others also, but there are technical issues, there are discussion, there are other things also. This is all one word: evidence, not fear. Lots of experts from UK, from America, from Germany, and other places have spoken about this matter. Another thing that I will recommend is a book called Corona False Alarm. This is available on Amazon. Whoever is able to read, you should read this book. Okay. Anyway, I'll give you some references in the end, inshallah. So if this is not a killer virus, if it is not a pandemic, then we go back to the original definition, the Islamic criteria. What did I say? The first condition is there a need? Is there a need, haja, for the vaccination? So we say, really, it's not established. For what I have said so far, you can easily see there isn't a need. We are already exposed. We have the immunity, and this immunity is there to protect us, and this is sufficient. If we take the vaccine, it may add to that a little bit, but this will last for maybe 4 months, 7 months, 10 months. They want us to, so that you repeat that every year. So every year we'll be taking the vaccine for no reason, no justifiable reason. And there are other issues, I will come to that. In addition, the experts, they have mentioned a criteria for the vaccine. Okay, pay attention. These are not some foolish statements, but these are statements of those who are mahirin, expert in this. They have set a criteria for the vaccine. In fact, I didn't mention that when we decide is this a pandemic or not pandemic, there is a criteria for that. WHO had a criteria until 2009 for their definition of a pandemic. And that included 3 things. Number 1 is that the pathogen must be new. An organism which is causing the illness should be new. So we said, yeah, this COVID-19 is a new, it's a variant. Number 2 is that the pathogen must spread across the continents. So, okay, this has happened. Number 3 is that the pathogen must generally cause serious and often fatal disease, generally, which means it should not be, this has demarcation that is only over 80 people who are more affected, or people who have other illnesses, or people who are overweight. These are the 3 categories. General masses have no effect. 80% people recover from symptoms, and some people have very mild symptoms, some people have no symptoms. Okay, so this was the criteria until 2009. When the swine flu came, they said that the pandemic can be serious, can be mild. So they changed the criteria. They removed the 3rd one. Now they more simplified the definition, saying that flu. They say that the definition of pandemic is the worldwide spread of a new disease. Khalas. So if you find the worldwide some virus, this is enough. So change the definition and to turn it into a pandemic. And we know that this definition, this is how they applied on the swine flu, and we have seen what has happened about the swine flu. Millions worth of vaccine was thrown away, wasted. And watch the video again, you will see it's a repetition of really. Okay, so then we come to the as I said, the criteria for the vaccine. What is the criteria the scientists have? There are 3 things in that. Number 1, they said when an infection regularly leads to severe illness or severe complications in the healthy individuals. They didn't say in the old people, they didn't say in the people who have multiple illnesses. No, in the healthy individuals, if it regular, if you fall ill, like was the case of smallpox, everyone will be affected equally. There was no distinction that the children will not affect or the only old people will affect. Well, it was affecting everyone, and it will destroy their life. So something which was regularly around and all the time will affect and will lead to serious illness or serious sequelae, meaning serious complications. Second, if the mass vaccination is not reasonable, if a large part of the population is already sufficiently protected, then vaccine is not recommended. This is the case with the COVID-19. Large population is already protected because of the generation of antibodies. They had subclinical infection or mild infection, and the majority has the immunity. So vaccine has no place in this. They have some other counter argument. Those arguments are weak arguments. I'm not going into that because it will become very lengthy. Thirdly, that they say when vaccine is likely to be unsuccessful is that if the vaccination fails when a virus coexisting worldwide with man and the animal will undergo mutation. So you bring one vaccine today, tomorrow it will mutate. You have to bring a variant of the vaccine. They say now we have the luxury, we can modify very quickly because we have the basic blueprint and we can change. But why? Viruses always, all the time go through mutation. You know that, still advocating that. So this is the third factor. So we said that there is no need for the vaccine. It does not fulfill the criteria for the vaccine. So there is no need for that. Okay. So we have, alhamdulillah, looked at the first question of, is there a need? Sufficiently. So it should be clear. Then we come to the second condition, which is the knowledge about, do we have sufficient knowledge about the vaccine? And when we say knowledge, there are three things. As I said, halal, is it halal or haram? So we said, okay, and if we trust what they are saying, this is an mRNA vaccine. They shown that the ingredient, because this is a lab synthesized vaccine, there's no live material in it, nothing, no animal product. It has some sugar, some salt, some lipid, and that's how it is made. It's a simple formulation. There is some detail given on the MIT website and other places, and the manufacturer, they have informed that this is how. So we say, okay, that's fine. It's halal. And it's permissible. Is there any safety issue? We have problem. We have big safety issue in here. The safety issue of this vaccine is that the majority, as I said, the majority of healthy individuals have these killer lymphocytes in their body, which will recognize the virus. When they recognize the virus, it's not very common, it's rare. But in that, they can produce a very drastic response, a heightened response. So an inevitable autoimmune attack will be mounted against the cells. And this can lead to, the problem is that then it passes through some area of the brain, and it can cause very drastic effects. And this has actually happened in some of the previous use of the mRNA vaccine. And because of that, despite that this is in a very small proportion, it is they say that, okay, this is 1 in 10,000. You have more risk of dying when you go out by traffic accident. Okay, traffic accident, you don't invite yourself. You take all the precaution, but this vaccine you are taking, and you know that there is a risk. Would you like to put yourself in that 0.01%? Nobody will say, no, I don't want to. I want to be in the 99.9%. But there's no guarantee for that. Okay, Ibrahim, I want to see that document again, the MFA document. So the two things that we have to see, number one is the safety, number two is efficacy. Okay, they say 95% efficacy. So I want to show you what is 95% efficacy here. The same, the patient's leaflet of the MFA. Okay, here if you see, both the questions are answered here. Okay. Can we go further down? Yeah, stop there. Okay, so first, if you see on the left side, this is the efficacy issue. There's a 95% efficacy claim. This is what they have said, that the trials are only investigating whether the vaccine reduces mild symptoms. Okay, and they found some cases out of those 44,000, a few hundred, which the symptoms were taken care of in the vaccine group more. They got better. So this is why they said that this cannot answer, number one, will the vaccine save lives? There's no answer for that. Ask them, ask those experts who talk about this. They will say the data is not available yet. Number two, will vaccine reduce severe illness or hospital admission? We cannot answer. Will the vaccine prevent transmission of the virus? We cannot answer. Data is not yet available. Is the vaccine safe and effective for children, adolescents, and immune compromised individuals? They say this is excluded from the trial, so we cannot answer. They are offering those people, some of them, but that's what they would say. Okay. Then if you go to the right side of that, there is one thing that I want to point out, that you see that number needed to vaccinate. This is NNTV, which is a marker which they use for the vaccine, which shows that how many people you have to vaccinate to prevent one case. So for this vaccine, they said 256 cases you have to vaccinate to prevent one case, which means the 255 remaining, they are being given vaccine for no reason. They will have side effects, adverse effect. For that purpose, they are being given really. So is it really beneficial? Is that this document, you can go and you can look at this more when you have time, and you will see that there are more issues mentioned on this document. The same group has written a letter to the MHRA, Medical and Health Product Regulatory Body. There you are. You can see that, and the copies are gone to the Health Secretary, Matt Hancock, as well. Read that letter when you have time. So they've highlighted all that. And one thing that they pointed out is this, you see, okay, in the previous document. Can we go back to the previous document? Yeah. You see that on the right side, no, go up, Ibrahim. The beginning of the document. Yeah, stop there. So you can see that there is this thing that antibody dependent enhanced immunity, ADEI. Yeah, this is what I was talking about. Can cause severe illness or even death in vaccinated people. They have also mentioned that there is some concern about the infertility, but that's not established, and the other side will reject that nothing like this, etc. But anyway, let's go back to the. No, I just want to go back to the whiteboard. Remove the document. Okay, so so the issue of safety is not established. Okay, in fact, the gist of this is that this vaccine is in the third phase of the trial, which is not completed yet. Okay, by offering you the vaccine, you are part of that trial without wanting to be in the trial. They will say, no, this is a parallel fourth phase, etc. For me, this is nonsense. You cannot establish neither the safety nor proper efficacy in less than maybe 3 years. Okay, this rushed bringing out of the vaccine, they can make as many technical reasons not acceptable, not right. So, and then the vaccine is actually not licensed. Many people, they are saying that, license. No, it's not licensed. What the FDA has done is that they have issued the emergency use authorization. This is not licensing. Because they said, because of the pressing need of this pandemic, which is in itself is a wrong statement, and because of the very high efficacy, overwhelming any safety issue. So that's why. So we said both are wrong statements. And efficacy is not established. Safety issues are not established. Okay. So then we say, okay, so we have to have the knowledge of the treatment that we are taking. As Rasulullah said, alimahu man alima, jahilahu man jahila. The one who knows, he knows. The one who does not know, he does not know, to mean that he should not take it because he does not know about it. So ilm about what? Ilm about whether the thing is halal or not. So we said, okay, we accept what they are saying. Whether is there any darar in it, any safety issue? We said we don't know. This is not clear. Is it mufid? Is there fayda? Any benefit, efficacy? It's not established. What we know is that very little. As I have explained, that the immunity is short-lasting, so the agenda will be that you take this vaccine every year. Just imagine billions of people taking this every year. MashaAllah, this is good revenue. And the WHO is known to have that video which I showed you about the swine flu scandal. If you remember, the person who was speaking, Dr. Wolfgang War Dog or something, German. He was the chairman of the health subcommittee of the parliament of Germany. He's been removed now. Why? Because he spoke against on this issue. So they've removed him. He has, in his words, if you see this website, Evidence Not Fair, there is an interview by him in which he said that the WHO is an untrustworthy, unreliable organization. There's a lot of corruption over there. And the pharmaceutical companies are involved in that. Or something like that. So this is the whole issue. Now you have the answer. So we know, as I give you the framework of the Islamic criteria, that there should be a need and there should be knowledge about the treatment you are using. And on both accord it fails. So now the rest is up to, I'm not telling anybody you must not take, or anything may change after 2-3 years if the trial went okay, but still we will say that the need is still questionable.